and welcome to the City of Houston special, supporting our children during the COVID-19 crisis. My name is Juliet Stipeche, Mayor's Director of Education for the City of Houston. I want to thank Councilmember Carla Cisneros and members of the city's Childhood and Youth Committee and Mayor Sylvester Turner for allowing me this unique opportunity to some time with you here today to discuss what the city and the mayor's office has been doing to support our children, families, and communities. We offer our sincerest condolences to those who have lost loved ones in this tragedy. We pray for those sickened and adversely impacted by this terrible disease. We are living in very challenging times in our history. Danger and uncertainty abound, but they are surpassed by Houston's creativity, selflessness, and compassion. Disruption causes enormous challenges in our daily lives, but we're here today to discuss how we're building new bridges and creating new collaborations. On behalf of Mayor Sylvester Turner, we want to thank everyone who is keeping the city running. Thank you to our essential workers. We thank our first responders, our healthcare and public health employees, our allied healthcare professionals. We thank our municipal employees, grocery store employees, delivery workers, construction workers, child care workers, and civil servants. We appreciate you, and we love you. The Mayor's Office of Education works to create collaboration, communication, and coordination amongst the educational entities that exist in the City of Houston. Mayor Sylvester Turner created the city's COVID-19 task force, comprised of his offices, to work on tackling this plague's unique challenges. We have worked closely with city directors, including Marissa Aho, Mayor's Chief Resiliency Officer, to design what we are discussing here today. We have collaborated with other partners, including Harris County Judge's Office, the Region 4 Education Service Center, including Dr. Pam Wells and Superintendent H.D. Chambers. We know that the outstanding local superintendents and their respective boards, the Texas Education Agency, and others have been working hard to help. At the start of this pandemic, the Mayor's Office of Education decided to focus on 5 key areas. 1, food insecurity. 2, child care access. 3, digital access. 4, mental health. And 5, wraparound services or non-learning resources. Given our time constraints, I'm only going to focus today's report on our first 4 priorities. So let's begin. Food. The city's Vulnerable Communities COVID-19 Task Force Subcommittee has focused on food insecurity. Please note that schools and child care centers typically provide up to 2/3 of a child's daily nutritional needs. Food insecurity hurts children's immune response, potentially making them more at risk for contracting diseases. It's also linked to long-term academic, developmental, physical, and emotional harms if they do not have food. Schools are presently closed until May 4th and potentially may remain closed for the rest of the school year. The USDA has not mandated schools to provide meals during the closures, so school districts locally are taking charge to serve meals on a district-by-district basis. In Houston, we've seen schools, government entities, and nonprofits answer the call. They've provided summer meals and seamless meal options right now to help our families, especially our low-income families, during these extended school closures. While summer meals don't follow the same strict nutritional standards as school meals typically do, they do allow for more innovative strategies in terms of delivering meals, such as grab-and-go options at sites. We're examining models that are best for social distancing recommendations, especially when scaled up to serve more people. Yes, we are building the plane as we fly it in this COVID-19 environment, but we must address these issues that are exacerbating concerns in health and education disparities that exist now and for years to come. So please note that recent federal legislation is allowing more temporary emergency benefits under SNAP to families already enrolled. But children don't qualify if they're served by the Child and Adult Care Food Program or if they are undocumented. Changes to the public charge rule went into effect in February of 2020, so a path to U.S. citizenship can be denied if a person uses public benefits such as SNAP. In effect, documented immigrants may be discouraged from using SNAP or other emergency food options, leaving them increasingly vulnerable, which brings the importance of utilizing our nonprofit supports, our summer meals programs, and our seamless summer meals. We need your help. The Texas Hunger Initiative, THI, has mapped food services in the area. Please visit https://www.baylor.education/hunger-and-poverty/. The Texas Education Agency has a statewide database, www.txschools.gov. Please click on the link that says Meal Pickup Locations. Sharing these resources with the community is critical. If you know of a family member that doesn't have internet access, please help them. Share this information so it's available. Let them know the information that's on the website. School districts are also offering unique food distribution strategies, and the City of Houston's Parks and Recreations Department has 50 community centers open to distribute lunch and a snack Monday through Friday. Please visit www.houstontx.gov/parks/. Once again, please communicate these resources to your friends, families, and communities. Nonprofits addressing food insecurity, such as the Houston Food Bank, Second Servings, and the Interfaith Ministries are also available. They need your support. Clearly, the list of nonprofit providers that I've stated is not exhaustive. Consider donating your time and treasure to our local nonprofits as they're working hard to address food needs. And if you need help, dial 211. It's a free helpline operated by the United Way of Greater Houston, 24 hours a day, 7 days a week, in many different languages. Do we have any questions at this point? Let's check. Please note, if you have any questions concerning food, send them in. Email them to Councilmember Cisneros' office, and also you can email Mayor's Office of Education, and we will provide you an answer to your questions. Now we move on to the area of childcare. Mayor Turner, Judge Hidalgo, and the City of Houston recognize the challenges that you and your family face during these difficult times. Essential workers have kept our city and county operating since the very beginning of this healthcare crisis. On any given day, finding quality childcare is critically important for parents who work outside the home. And today, this is further complicated with school closures and many businesses that are closed. But did you know that childcare centers are considered essential providers that remain open at this time? In response to the unique challenges that exist, we have partnered with the Houston Endowment, the Harris County Judge's Office, to develop a child care solution for essential workers during this emergency. Rallying a diverse group of public, private, and nonprofit stakeholders, we developed a strategic child care plan and created a streamlined process for essential workers to find child care and also to apply for financial support. Launched this Monday, April 6th, essential workers just need to visit the site, www.findchildcarenow.org. This is available to all City of Houston, all Harris County employees, and all essential workers with children the ages of 0 to 12. Note, an essential worker is defined by the Texas Workforce Commission to include persons that work in pharmacy and healthcare, first responders, critical local and state government staff, mail and delivery services, nursing homes, child care, home health care, and other direct providers, such as those working in grocery stores, gas stations, banks, restaurants, drive-through and delivery, military personnel, and other workers defined as essentially needed by the TWC and local workforce development boards. If you're eligible to participate, this is also on a first-come, first-served basis. Once a family selects a center, and they can enroll right away. Another great opportunity is the Collaborative for Children will contact applicants within 2 business days to help you find a qualified, licensed child care center that best serves your needs. And if families wish to apply for financial support, do so in the registration process. You will then be contacted by a representative from Workforce Solutions within 4 business days to review options that are available for you. Workforce Solutions has generously allocated $10 million for childcare in the 13-county region, including Austin, Brazoria, Chambers, Colorado, Fort Bend, Galveston, Harris, Liberty, Matagorda, Montgomery, Walker, Waller, and Wharton counties. This funding will allow child care to be provided to at least 3,500 children of essential workers. We want to personally thank Tanyelle Edwards, the program director from the Houston Endowment, Chief Resiliency Officer Marissa Ajo, the Harris County Judge's Office, Workforce Solutions, Bain & Company, Collaborative for Children, the United Way of Greater Houston, the YMCA of Greater Houston, First 3 Years, Harvey Home Connect, Texas Policy Lab at Rice University, the Bridgespan Group, the Baker Institute of Rice University, and Children at Risk. Again, if you're an essential worker and need this service, register today at www.findchildcarenow.org. Now let's check to see if we have any questions. I don't see any, so let's go ahead and we'll be taking a short break. Thank you so much, and please stay tuned.
What is the 2020 census? Every 10 years, the census records everyone living in this country. It's written in the Constitution and comes in a questionnaire that counts everyone who lives at your address on April 1st. The data can be used to inform funding for services like fire stations, schools, clinics, and representation that affect your community. Shape your future. Start here. Visit 2020census.gov.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Welcome back. Now we're going to discuss digital learning. This pandemic has transformed the way we work, learn, interact. Our homes have become extensions of the workplace, the schoolhouse, and the coffee shop, all at the very same time. We're trying to find new ways of working and learning at home while living with our family and our pets. With tech and trust, we're no longer bound to a traditional office, let alone an archaic landline. We now welcome and invite others to interact in our sacred spaces. We capture glimpses of people's homes, family photos, art, pet, sometimes crying babies. I've never used Microsoft Meetings, Zoom, Google Hangouts, Chat, Skype, or even FaceTime until COVID-19. My learning curve has been steep, but largely efficient. Our professionals and personal lives are now inseparably married to tech. I'm blessed with the essentials, hardware and internet access. But what happens if you don't have a relationship with tech in these troubling times? In the education space, post-secondary institutions have transitioned the most rapidly to offer online classes to students. By way of example, before COVID-19, Rice University offered only 3 4-credit courses online. When it restarted on March 23rd, 1,906 online courses were offered. Online education has been around for a while, but it's not been universally embraced in the education world until now. With emergency distance education, we're witnessing a revolution in the teaching and learning process. We need to develop an equitable system of digital learning that also incorporates the essential social, emotional supports and developments that are critical for our society. We've been privy to conversations at the local, state, and national level regarding remote learning, the digital divide, and creating a new system of teaching. It moves rapidly. It's a work in progress. It requires patience, risk-taking, forgiveness, and creativity. The K-12 system is working its very best to meet these unique challenges, offering digital learning coupled with the delivery of old-fashioned paper instructional packets. All educators are valiantly jumping into this novel environment, focused on the needs of their students to allow instructional supports to continue. They're learning about digital resources and connecting to the unique needs of the children and families in the unique communities that they serve. There are three primary challenges in bridging the digital divide. Do students and educators have the hardware that they need? That includes computers, power cords, routers, cables. Do they have internet access? If 1 and 2 are satisfied, then what instructional supports are offered digitally? Local superintendents have been rallying hard to solve these questions. The City of Houston has been supporting their efforts in looking at internet access equity throughout the city. Director Shannon Buggs has been examining this issue as part of Mayor's Complete Communities and continues to lead this effort today. We also have the inclusion of the Office of Emergency Management, the Office of Innovation. Folks are working together. We also have planning and development and children at risk, examining digital access issues and creating maps to help us understand those areas that need service most. And Mayor's Office of Education has developed and continually updates a digital research page for our community. It's time for us to be creative and collaborate in this issue. A best practice example is CompuDot. It's been giving away refurbished laptops for children in need. If you need a computer, please visit www.compudot.org/COVID for updates regarding this program. CompuDot has given away thousands of computers, but it needs your support. So we're asking private citizens, government entities, private companies that have computers no longer being used, please email donate@compudot.org to set an appointment to provide your gift. Your old computer may be a lifeline for children and families in need at this critical time. Comcast's Internet Essentials is now offering a 2-month free promotion. While it's only available to those who qualify, it's open to most low-income persons as long as they live in the Comcast footprint. Please visit https://www.internetessentials.com/ for more information. And AT&T has announced that it's suspending broadband usage caps for our home internet customers. That means no coverage fees while people are using more data. They're keeping public Wi-Fi hotspots open for anyone who needs them, and they're offering internet access for qualifying limited income at https://www.att.com/internet/access/number!! New customers who order access by April 30th will receive 2 months of free service, $5 per month or $10 per month thereafter, depending on your speed. It'll also expand eligibility based on income to households participating in the National School Lunch Program, or Head Start. It's waiving all home internet data overage fees once again. We are asking all internet cable service providers within the City of Houston to please contact us with any and all benefits, specials, promotions being offered by your company as part to help out in the COVID-19 crisis. We will update our digital resource link and share it with others. Which brings me to the Mayor's Office of Education webpage. https://www.houstontx.gov/education. We have a page listing e-learning resources and supports during this time of need. These resources come to us from local, state, and national partners. We also ask, please share with us quality, low-cost, no-cost digital resources that you know about, and we'll consider adding it to our local resource page to help our community. Remember, though we are apart, we remain together. That's especially true at this moment. Now we're going to move on to health and mental health, which is a very large area given that this crisis is a health crisis. We want to thank you for honoring, respecting, and carefully following recommended health advice concerning COVID-19. For instance, I'm wearing a mask. As a reminder, the virus is spread mainly from person-to-person contact. Recent studies show that a person may be infected but may be asymptomatic, and they might spread when they're not demonstrating any symptoms. There is currently no vaccination to prevent COVID-19, and the best way to prevent illness is to avoid being exposed to the virus. We want to reiterate the CDC's prevention guidelines. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, sneezing. If soap and water aren't readily available, use hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact. Stay at least 6 feet away from others. Avoid close contact with those that are sick or vulnerable to the illness. Stay at home as much as possible. Everyone should wear a cloth face cover if they go out in public. For example, if you go to the grocery store, if you go to the office, or if you have to pick up other necessities. Cloth face coverings don't need to be placed on young children under the age of 2. Anyone who has breathing trouble or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Cloth face covering is meant to protect people in case you're infected. Don't use a healthcare designed mask. Please try to use one that is not designed for healthcare providers. We need those for our first responders and healthcare workers. Continue to keep about 6 feet between yourself and others. And remember that a face covering is not a substitute for social distancing. Clean and disinfect frequently touched surfaces. That includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. And if surfaces are dirty, then use detergent or soap and water prior to disinfection. And to disinfect, the most common EPA-registered household disinfectants will work. Options include diluting household bleach to make a bleach solution. You just mix 5 tablespoons of bleach per gallon of water or 4 tablespoons of bleach per quart of water. Follow the manufacturer's instructions for application and proper ventilation. Check to ensure the product is not past its expiration date, and never ever mix bleach with ammonia or any other cleanser. It will produce a poisonous gas. Ensure your alcohol solution has at least 70% alcohol once again. And you can use other EPA-registered household disinfectants, but for more information, make sure to check out the CDC's website at www.cdc.gov/prevention-getting-sick/index.html. Social distancing and staying at home. You're making a difference by staying at home. According to a recent report from Rice University's Kinder Institute, 4,533 lives have been saved in Harris County by staying at home. Estimates show that social distancing and measures during the 14-day period between March 24th and April 6th have saved lives. This has also kept 48,812 people from being hospitalized locally. Also, not everyone can stay at home. So please keep our essential workers safe by staying at home and going out only when necessary. Faithfully practice COVID prevention measures, and remember, while we're apart today, we're making sure we'll be together tomorrow. Your hard work is necessary to make progress against COVID-19 a reality. Now with interventions, there are several sites that are available for you to be able to look for a test should you have a dry cough, fever, tiredness, difficulty breathing. First, call your healthcare provider or call the City of Houston's Health Department's COVID-19 call center. We have these resources available online for you to be able to look at from the Houston Health Department and the Harris County online site. Also notice that there is other options that are available in the community for you to be able to utilize. Now, I also wanted us to be able to talk briefly about the area of mental health, because we know that mental health is extraordinarily critical at this time. And we know that a lot of people are, feeling the pressure and the stress that is, compromising our ability at this time. Everyone reacts differently to these situations, and your own feelings will change over time. But if you need some help, or if you know of someone that needs a help, please know that the Harris County COVID-19 mental health support line is available 24 hours a day, 7 days a week, and the toll-free number is 833-251-7544. Please call them if you need help. And we've also been blessed to work with so many outstanding healthcare partners from Baylor College of Medicine, Texas Children's Hospital, UNICEF USA, the Harris Center, Mental Health America, the Collaborative for School Behavioral Health. All these individuals, including Texas Children's Hospital's Trauma and Grief Center, the Meadows Health Institute, and Menninger, have been working with us to help develop psychosocial emotional supports for children impacted by trauma. Children react differently from adults, and so they have advised us to make sure that if you see any dramatic changes going on in your child, that you please make sure that you provide them with the supports they need at this time. Remember the 6 S's: safety and security, simple language, supervision, structure, social support, and self-care. Give your children time and support to adapt to this normal. Support them through teachable moments, including how to cope with stress and how to focus on what matters, such as their health and well-being, and how to do their part in ensuring that we're keeping Houston strong. In my closing, I'd like to say thank you very much for joining us today. United against this disease, we will overcome it. We are apart today, but we'll be together tomorrow. Remember, Houston, you're a part of the solution. Be well, stay safe. Together, we are Houston strong. Thank you.